You have questions. We're going to answer a few of them today by spinning the wheel of health. Today's wheel has 10 questions from viewers at home. We're going to answer whichever one the wheel lands on. Let's go ahead and spin the wheel. First question, what is fungal acne and how is it different than regular acne?
So actually this is kind of a trendy topic right now. I feel like I've been getting asked about fungal acne more. And what it is very similar in appearance to good old garden variety acne that many of us get around puberty and teen years, but the difference is it's due to a fungal or yeast organism called Pityrosporum. And that actually is a natural flora. It lives on the skin.
That's what I was going to say, that it's natural for us to have some fungus on our face.
It is. It's a normal part of your microbiome, and we think when the counts get a little bit higher, which is usually in a really oily area of your face or in a moist, humid, sweaty environment, because yeast and fungus love moisture, you can get this eruption, which is a little different from acne in that all of the spots just seem to come on at once. They're very similar in size and shape, and sometimes they're itchy. And if you're really looking closely, you'll see that they're around the hair follicles. You can even get these little pustules around the follicles. This is a perfect picture of it, actually. And it has a fancy name because it's not truly fungal acne. It's called Pityrosporum folliculitis. And in this case, all the typical acne medicines are actually just going to irritate it and make it worse. You can try a couple over the counter, maybe salicylic acid, maybe benzoyl peroxide, but if they're not working, this is maybe something you should bring up with your doctor, your healthcare provider, and say, you know, I've been trying all these over-the-counter products for acne, it doesn't seem to be getting better, it's a little itchy, and in that case, an antifungal or anti-yeast agent, either orally or topically, should clear it up.
Thanks, Dr. B. I love it.
Yeah, that does have a different look.
Yeah, it looks slightly different. I think we had a picture of acne next to it, and I think the big diagnostic difference in the second picture, the regular, is that you can see spots in all different stages of evolution. Some are red, some are inflamed, some are pustules, and they're not necessarily centered around hair follicles if you were to look very closely. So that's one giveaway.
Should we spin the wheel one more time?
Sure.
Let's do it. Let's spin it. Gummy vitamins, OD. Question, is it possible to overdose on gummy vitamins? What do y'all think?
Yeah.
And the answer is yes. In particular, what you worry about with any sort of vitamin are the fat-soluble vitamins, A, D, E, and K. Certain minerals like iron, zinc, niacin, these things can all potentially build up in the body. And look, gummies, they work, but because sometimes they taste so good, people will start popping them like candy because that's what they taste like. And I will say that the issue if you're starting to overload on these fat-soluble vitamins is the symptoms are so nondescript. You may have very few symptoms, you might have a little nausea, but it's not as though it's one of those, okay, it's obvious that I'm a little high on vitamin A right now.
Right.
And so that's why I would always, if you're going to take gummy vitamins, remember, these aren't candy. This is a supplement. This is a medication, so take it as directed. Even more important with your kids, these are going to be up somewhere where your kids can't get to them. And if you're going to use these, you hand it to your kid. This is not candy. This is medicine. And just be careful with that. You know, I was looking at the statistics back in 2014, 50,000 cases of adverse vitamin effects called into the Poison Control Center. So adverse effects can and do happen. It's funny, I'm looking at these right now, and what do I want to do?
You want to eat one?
I do.
Of course, I was just thinking they look tempting.
I would too, but they'll get stuck in our teeth.
But I think your point about kids really can't be overstated because kids really do view these as candy. They taste good. They have as much sugar. So do adults. Yeah, they have as much sugar as regular gummy bears, and you have to be so cautious because they really are medicines, and you can come home and find your kids out a whole bunch, and that can be very dangerous.
I grew up on the Flintstones vitamins. You remember those?
Yeah, I remember those.
Those were good.
But
those
were pretty chalky. They weren't yummy like that.
Well, and
Like,
that's why
like
you take yours and you're like, that's not
Yeah.
that great, but I guess I'll finish it. So certainly be aware.